welcome to the 127th meeting of the Standing Committee on the Status of Women. This meeting is being televised. Following the motion adopted by the committee on December 3rd of 2018, today officials from the Department of Indigenous Services Canada will provide the committee with a briefing on the government's efforts to immediately end the practice of forced and coerced sterilization of Indigenous women. For this, I am pleased to welcome Valerie Gideon, Senior Assistant Deputy Minister, First Nations and Inuit Health Branch, and Catherine Cole, Senior Manager, First Nations and Inuit Health Branch. I'm going to turn the floor over to you for opening statements, so approximately 10 minutes. Okay, you have the floor.
Thank you very much. Thank you for inviting me to appear before this committee on this critical issue of forced or coerced sterilization. I'd like to begin by acknowledging that we're meeting on the unceded traditional territory of the Algonquin people today. Nous sommes ici aujourd'hui parce
We are here today because we are all disturbed by reports of forced and coerced sterilization of Indigenous women in this country. I want to acknowledge these women and recognize their bravery. I speak as a First Nation woman, member of the Mi'kmaq Nation of Geskagag of Quebec, and a mother of 2 young girls, and as someone who has dedicated her entire career to advocating for the health of Indigenous peoples, both outside and inside the public service.
sterilization is a serious violation of human rights and medical ethics. It is a form of gender-based violence and evidence of a broader need to eliminate racism and discriminatory practices, ensure cultural safety and humility, improve culturally competent informed consent, and remove barriers that Indigenous women face when accessing health services in this country. This issue is an indication of racism in the healthcare system, and addressing it is a matter of reconciliation, as cited by the Truth and Reconciliation Commission. All Canadians have a responsibility to ensure that these practices never happen again. In the motion passed to request this appearance, the government's commitment to the United Nations Declaration on the Rights of Indigenous Peoples was raised. As you may know, in May 2016, the Minister of Indigenous and Northern Affairs announced that Canada is a full supporter without qualification of the Declaration. The Declaration is a statement of the collective and individual rights that are necessary for the survival, dignity, and well-being of Indigenous peoples around the world, and the government must take an active role in enabling these rights to be exercised. It will fulfill its commitment to implementing the Declaration through the review of laws and policies, as well as other collaborative initiatives and actions, some of which I will outline today. Ce comité a particulièrement
This committee has specifically raised Article 7.2 of the Declaration, which states that Indigenous peoples have the collective right to live in freedom, peace, and security as distinct peoples, and shall not be subjected to any act of genocide or any other act of violence, including forcibly removing children of the group to another group, unquote. I would also like to point out that the principle of free, prior, and informed consent is central to the Declaration. In its July 2018 resolution on forced sterilization, the Assembly of First Nations stated that, quote, the forced sterilization of Indigenous women by medical professionals breaches the free, prior, and informed consent standards contained in the UN Declaration, end of quote.
Sterilization is not something that any one profession or order of government can address alone. Federal, provincial, territorial, Indigenous governments and organizations all have a role to play. At the same time, coerced sterilization is a matter of the practice of medicine. Only surgical practitioners, such as obstetricians and gynecologists, can perform surgical procedures such as tubal ligation, so doctors and those who regulate the profession must be involved. Informed consent policies are administered at the local level, which means that hospital administrators and the health authorities that they work within must also be part of measures to ensure free, prior, and informed consent and culturally informed and safe practices. In keeping with its commitment to the recognition of rights, respect, cooperation, and partnership, the federal government can play a leadership role in convening these bodies to facilitate dialogue and action in the spirit of the UN Declaration and the principle of free, prior, and informed consent. Le gouvernement jouera ce rôle de
The government will play this leadership role by reaching out to provincial and territorial ministers of health as well as medical associations to seek ways to work collaboratively to ensure safety and respect for for Indigenous women in Canada's healthcare systems. Today, a letter was sent by the Ministers of Indigenous Services and Health to signal Canada's intentions to bring together federal, provincial, and territorial officials to engage with Indigenous groups and national provider organizations on measures to ensure cultural safety and humility in health systems.
Services Canada, the department that I represent here today, we have been acting on this issue for several months, and for the sake of time, I will outline some of our more recent actions. Last week, we held a teleconference with Indigenous organizations and national health organizations to discuss ways to advance collaboration and identify actions that will ensure free, prior, and informed consent and culturally informed and safe services for Indigenous women across Canada. The teleconference was part of our efforts towards a forum in early 2019. This is a milestone event that we had decided to undertake in June 2018 at our Senior Management Committee, where the Assembly of First Nations and Inuit Tapiriit Kanatami are full members, and where we had invited the Native Women's Association of Canada and Pauktutit, the National Inuit Women's Association, to attend as special invitees. The forum will be an opportunity to convene Indigenous and professional associations to mobilize actions for Indigenous women's reproductive health and to discuss a recommendation received at the Inter-American Commission on Human Rights in Bogota, Colombia, to issue guidance regarding sterilization procedures. Une autre recommandation formulée à
Another recommendation made in Bogota was to produce an information brochure for healthcare providers and patients on proper and informed consent in the context of women's health services. We have been in discussions with national Indigenous women's organizations to make this happen. We are also establishing a new advisory committee on Indigenous women's well-being to inform the department on current and emerging issues, including sexual and reproductive health. The inaugural meeting will be held in January 2019, and we are pleased to have several Indigenous women's organizations already confirmed to participate as full members.
Responding to recommendations made at the Inter-American Commission on Human Rights, Indigenous Services Canada endeavours to support Indigenous women's reproductive health more broadly through its programs and policies. The Maternal Child Health Program, which was introduced in 2005, offers community-based home visiting services by nurses and family visitors to over 8,100 pregnant women and families with young children in over 300 First Nations communities. Through the program, expecting mothers receive case management, screening, assessment, and referral services, as well as health promotion strategies to identify risks and improve maternal child health. Budget 2017 increased the existing program funding of approximately $25 million annually by $21.1 million over 5 years, which represents a 30% increase. With $7.5 million ongoing from year 5, the total investment by 2022 will be $32.5 million annually. De plus, le budget de 2017 a prévu.
In addition, Budget 2017 invested $6 million over 5 years for Indigenous midwifery, the first ever federal investment into this area. Midwifery care to Indigenous communities has been identified as a pathway that improves health and well-being of women, their children, and the entire community, and it signals a repatriation of birthing into communities, a long-standing traditional practice. Furthermore, informed choice is recognized as a central tenet of midwifery care in Canada.
Investment in midwifery is historic for the federal government. It represents just a first step. Most Indigenous families in Canada are still with very little or no access to midwifery care. There is some evidence that midwives not only support women in their reproductive health planning, which may prevent further cases of forced or coerced sterilization, but also provide support to women in preventing custodial loss of their children. Senator Yvonne Boyer and Dr. Judy Bartlett have found that past custodial loss or the threat of custodial loss played a role in coerced sterilization in Saskatchewan. Further work is required in this area, and we are looking to Indigenous midwives' leadership to better understand. We are very pleased that the National Aboriginal Council of Midwives has agreed to sit on the Indigenous Women's Wellbeing Advisory Committee. La présence d'une personne de soutien.
The presence of a support person in labor offers many benefits to a laboring woman, including assisting her with decision-making and advocating for her wishes. Budget 2017 also included new investments to strengthen maternal supports by ensuring that all First Nations and Inuit women are entitled to an escort when they have to leave their community for childbirth. Indigenous Services Canada's non-insured health benefits program now provides coverage of an escort to accompany expecting mothers, regardless of their age or medical condition, recognizing that no woman should have to birth alone.
Has committed to implementing the Truth and Reconciliation Commission calls to action, including calls 22, 23, and 24, which pertain to using and recognizing the value of Aboriginal healing practices, retaining and increasing the number of Aboriginal healthcare professionals and providing culturally competency training, and anti-racism and cultural competency training for all medical and nursing students. Our department has been exploring with the Royal College of Physicians and Surgeons of Canada and Indigenous organizations project ideas for an online repository of cultural competency learning tools. And last year, the Royal College approved Indigenous health and cultural safety as a mandatory component of postgraduate medical education and certification. In 2013, all Indigenous Services Canada's health-related operations were transferred to the control of BC First Nations under a newly established First Nations Health Authority, which we refer to as FNHA. The FNHA has done remarkable work with the province and its regional health authorities in finalizing a declaration on cultural safety and humility and informing cultural safety and humility training across the provincial health system. The FNHA is presently developing the first ever cultural safety and humility standard in partnership with the Health Services Organization, which is affiliated with Accreditation Canada, and we are funding this work. We are hopeful that other provinces and territories will look to this work as a promising practice, and it is a key item that we will bring forward to the newly formed Federal Provincial Territorial Working Group, which I referenced earlier. L'Association des Femmes Autochtones.
The Native Women's Association of Canada and Paktutut have been providing leadership on Indigenous women's health, and as our relationship with these women's organizations grows and expands to include Les Femmes Michif Otipemsquak, we are encouraged by their good work and guidance. Their collaboration in assessing the issue was essential to getting this right.
Racism and the effects of colonization do not interfere with the health of Indigenous women. And I want to assure you that we are taking this matter very seriously and working in the spirit of collaboration and partnership towards culturally informed and safe health services for Indigenous women throughout Canada. And I'll be pleased to answer any questions that you have.
Excellent, and thank you very much. For our first round of questions, each member will have 7 minutes, and we will begin with Pam Damoff for your 7.
Thank you very much, Chair, and thank you both for being with us today. I think everyone around this table can agree that women should have full control over their reproductive health, and that these coerced sterilizations are wrong and they should not be happening. So, I mean, we're starting from that point where we're all agreeing and we want something to be done. And you mentioned that the minister is meeting with her provincial and territorial colleagues. I'm wondering, in terms of meeting with the medical professional organizations as well as involving Indigenous leadership as well, how is she steering all of that together?
So we started with some exploratory conversations with the Indigenous women's organizations and the national Indigenous organizations to see if they would be interested in working with us on an ongoing basis with respect to these issues. Our minister and the Minister of Health are writing to provincial and territorial ministers in order to seek their collaboration as well and their interest in participating in a federal provincial territorial working group to work through this issue, as well as to look at preventative measures such as cultural safety and humility. We will be, of course, inviting Indigenous women's organizations to also participate in that and to work with mainstream health organizations. I think the relationship between Indigenous women's organizations and mainstream health organizations will be built over time as well. There has been many collaborative efforts that have been led by mainstream health organizations over the last number of years, but in some cases they haven't worked together before. They really do need to get know each other and actually build that relationship.
So is she working with the medical licensing bodies as well?
So the Royal College of Physicians and Surgeons of Canada, the College of Family Physicians of Canada are also interested in collaboration, but actually also through her outreach and our outreach to provinces and territories, we will also be needing to engage with provincial territorial licensing bodies as well.
Thank you. Do we have any statistics on this? Is there any data? I know that there are women that are coming forward, but is there any data on how many women have been impacted by this practice?
No, we don't have any of that information. There's been some scoping work that has been done through Senator Boyer and Dr. Bartlett's work through the external review that was specific to Saskatchewan, but we don't have national data. I mean, we have data on the number of hospitalization procedures that occur by province that also involve sterilization, but that does not give you a sense of the consent, and it's not disaggregated by the population in terms of knowing how many of those women were Indigenous.
Right.
So there would need to be quite a lot of research done in order to be able to get some statistics of that nature, but it also will depend on women coming forward. And so that needs to be a very culturally safe environment as part of the research design that you would do to ensure that Indigenous women's organizations lead that and are part of structuring that work so that women feel safe to come forward.
In November of this year, Senator Murray and Sinclair said that when he was documenting stories for the Truth and Reconciliations report on the legacy of residential schools, this issue came up and in the hearings in Saskatchewan. And he suggested there was a need to, for an evaluation of the child welfare system and its involvement in this horrific practice. And I wondered if you could give your thoughts, the department's thoughts on the role that the child welfare system has played in women being coerced to be sterilized.
Well, I would say that, again, in Senator Boyer's work and Dr. Bartlett's work, there was a direct connection that was made between some of the women that came forward and told their story and their concern about involvement of child and family services. That was actually raised as a pretty important factor in the external review work. I think we have invited the individuals that are responsible for child and family services reform to be part of, and social programs overall in our department, to be part of the Indigenous Women's Wellbeing Advisory Committee, specifically because this is a cross-sectoral issue. It doesn't only belong to the health system. It will have linkages in other areas, including, of course, child and family services. But because we don't have a lot of research or information about what's currently happening or what's happening in the most recent past, it's difficult for me to answer that question for you, except to say that so far the women that have come forward has established that link.
Okay, thank you. You also mentioned the the calls to action from the Truth and Reconciliation report and the need for cultural competency training and getting more Indigenous people working in the healthcare field. I serve on the Public Safety Committee, and that's something that we have heard repeatedly is really challenging to get Indigenous people working in corrections. There's certainly been very positive steps taken, but what is the department doing to ensure that there is cultural competency training being done for medical professionals? Is there a role for the federal government to play in that? And also, what kind of outreach is being done to encourage Indigenous people to go into the medical profession?
So the department does fund bursaries through Inspire that are specific to the area of health. We also have for years worked in community to try and support health careers promotion. We did do a lot of sort of training of community-based workers as well to try and identify laddering opportunities for them to move into paraprofessional or health professional training and education programs. We've funded some specific initiatives such as Aboriginal nursing entry programs in certain universities and folks. I think that it's definitely an area that warrants further investment.
I don't have a lot of time left, but
Oh,
one
I'm
of the
sorry.
things that I've heard repeatedly, though, is that when people are not seeing role models in those fields, it's hard to think of themselves becoming a doctor, becoming a nurse, going into the medical profession when they aren't seeing role models. And so we've heard that, as much as possible to try and get those role models into community where young men and women can can aspire to following in someone's footsteps that they see. So I don't know if there's anything you're doing along those lines.
We used to have a role model program years ago, and it's definitely something that the department can relook at. I think Inspire does do quite a lot of work in terms of promoting some of its successful students that it's supported through the end into their careers as well.
Excellent. Thank you very much. We're now going to turn the floor over to Arnold Viersen. You've got 7 minutes, Arnold.
Thank you, Madam Chair, and thank you to our guests for being here today. I found it interesting right off the top, you talked about this being a human rights issue. How does your department, what do you see your role as your department in this human rights issue?
Well, I think our role is to support Indigenous women's organizations to help inform what would be public awareness materials that would help to support a better understanding and applicability of informed consent throughout the health system. We do have partnerships with Indigenous organizations, both nationally and regionally, that we can leverage in that regard. We also have relationships with mainstream health organizations, and so does Health Canada, and in working with them, we can also convene all of the individuals and all the organizations that need to be at the table to fundamentally have a significant culture shift in the Canadian health system and promote anti-racist and prevent discriminatory practices.
Have you been in contact at all with the Justice Department?
We have, in the sense that there is pending litigation also on this issue, and also the Department of Justice has helped us to have an understanding of the historical significance of the issue over time. So they are helping us with respect to research of documentation and also a better understanding of the historical nature of the issue.
Okay. Do you know if the government is coming forward with a piece of legislation around forced sterilization? I'm
not aware of that, no.
Okay. Is there any international sanctions that are being placed on us because of this? I know that the UN has a litany of condemnation for forced sterilization. Has there been anything international coming toward us because of this issue?
Well, the Inter-American Commission on Human Rights did table some recommendations, 2 of which really are housed in our department, which is to improve access to public awareness materials on informed consent and on guidance on sterilization procedures. We've also, Canada's also accepted the recommendation from Argentina specifically as part of the Universal Periodic Review and Canada's report on that front. And then last week, we received some concluding observations from the Committee Against Torture of the United Nations as well, and there are recommendations there for Canada as well to consider.
Because if this was in a wartime situation, we might be accused of crimes against humanity. Would you agree with that?
I'm not a global affairs representative. I regret to say it's just not my area of expertise.
Are you in contact with global affairs at all about this?
I have not been in contact with global affairs directly, no.
Okay. Now, one of the things that's interesting, I got 2 articles from the news media recently. The subtitle on this one is Morningstar McCurdy pictured November 16th, 2018, woke up from a surgery at 14 to discover her developing baby was gone. And what remained was an incision that was cut without her permission. The other article, I think this is probably the one that everyone's seen. When she was 17 years old, Liz was coerced by a child's aid worker in having an abortion and being sterilized in a northwestern Ontario hospital. She says this is an experience that she carried for 40 years. Reports from Alberta, Saskatchewan, Manitoba, and Ontario suggest that this is still happening. So forced sterilization is the topic that we're all talking about, but it obviously appears that other medical procedures are taking place without consent. Is this part of a broader effort on your part?
To understand the issue, you mean?
Yeah. It's like forced sterilization seems to be just one part of this.
Oh, I see. I'm sorry. Catherine is saying you're referring to also terminations and potentially other practices.
Yeah.
So I certainly agree that in reviewing this issue, we do have to consider other impacts on Indigenous women of racism or discriminatory practices that may be perpetuated in the Canadian health system in various ways, and to work with the medical professional and other healthcare practitioners, frankly, to just ensure that we have a much more culturally safe environment for Indigenous women across the country.
I had a chat with the former head of the Indigenous Physicians Association, and I asked him his thoughts on it a little bit. I'm wary to speak for him in this forum. I'd invite the committee to ask him to come in front of this as well. But he said the underlying issue is that there is a lack of, or there's this idea that there's an idea that you can have too many children. Is that something that your office has found, or your department has found as well, as the underlying idea that you can have too many children and therefore we need to step in?
Well, of the reports that have been written on this issue, I've seen that as a recurring theme. But in our department at this point, we've not sort of fully reviewed or done direct research with respect to this issue. We've read through the reports that have been submitted, and I have heard that as a theme that women who have come forward have reported.
Mm-hmm. Is there something in your litany of, I wrote down all the things you're doing, is there something in around that to train or to educate the healthcare system, saying like, these women choose to have this many children, there shouldn't be a problem with that?
Absolutely. Well, that would be part of cultural safety and humility training, is also to not exercise judgments that are not based on any cultural understanding or actually listening to the voices of the women themselves.
Mm-hmm. For sure. So I was interested that the first thing you mentioned off the top as an action that you're taking is a teleconference. Is that going to be significant enough action to end it? Because from this report anyways, I don't know if it's legitimate or not, but from this report it says that forced sterilization is still happening and the government's solution is a teleconference. Would we not want to engage the Justice Department on this?
So I was just going to say that was an example of the most recent initiative of where we've had dialogue with Indigenous women's organizations and other partners. We've actually been meeting and speaking with them separately for several months leading up to this point. We had a presentation back in June at our Senior Management Committee where we wanted to ensure that everybody was comfortable with the approach of setting up an ongoing advisory committee, also hosting a specific forum with experts who could come forward and actually offer some advice and recommendations about what needs to be done. And also we will be looking at research and in a way in which Indigenous women's organizations can provide a leadership role there to make sure, again, that women will come forward and feel safe to come forward. So that is a multitude of different actions. The teleconference is just an opportunity to sort of say that we have very strong interest and a lot of organizations that are interested in collaborating and working together to address the issue.
Excellent. Thank you very much. And now we're going to move over to Charlie Angus for your 7 minutes. You've got the floor,
Thank you,
Charlie.
Madam Chair. Thank you for having me at your committee. Thank you for your witness testimony. You said that you've been engaged in this issue for a bit of time. So when did you officially begin to look into the issue of forced sterilization of Indigenous women in Canada?
Oh my goodness. I mean, I would say last fall is when we started in 2017, really looking at it in a specific way. We've been looking at cultural safety and humility and racism in the healthcare system and the TRC calls to action much prior to that.
Okay, thank you. I guess I would have said I would be really shocked to have found that women are being forced to be sterilized in hospitals in the north and different communities, unless, of course, someone's actually seen what happens and the complete inequities faced by Indigenous people, that this kind of behavior is actually not all that shocking. I think what's shocking is it took the United Nations, their report on torture, it took a class action lawsuit to get this kind of issue brought to the fore. So in October 2017, right around the time you said you started to deal with this, that's when the class action lawsuit that named the federal government was brought forward. So were you aware of this before the class action lawsuit, or was it not a priority? Like, how did the class action lawsuit push your department into starting to address this and look at the cases?
I think it was just the fact that the practice is being reported to still being occurring today. I think that was something that was of significant concern to us. Within our department, we no longer run hospitals outside of 2 hospitals in Manitoba, and in those hospitals we don't have surgical procedures. So I think for us, learning that this was still something that was ongoing in the healthcare system was of particular concern.
Right, because measures to prevent births within national, ethnic, racial, or religious groups are prohibited by the Convention on the Prevention and Punishment of the crime of genocide, the UN has brought forward very specific recommendations for Canada, including a call that the names of those who've been involved in this behavior be turned over. So as a defendant in this lawsuit, would you be knowing of the specific cases where women have been forced sterilized? Are you willing to comply with the UN call to turn over the names of people who have been engaged in this practice to criminal sanction?
I really can't comment on pending litigation, and again, it's not my area of expertise with respect to that piece of the litigation.
Have you taken any steps to hear directly from women who have been sterilized so you can have a better sense of the inequities and the abuses that are happening within the system?
So we've been discussing with national Indigenous organizations how to approach that, how to approach either research or outreach in a culturally safe way. I think that this is our first meeting of the advisory committee, which is planned next month. This will be part of our agenda. I've had some preliminary discussions with the organizations, but I do think that it's important to reflect on what will be the best approach. Even in the external review that was conducted by Senator Boyer and Dr. Bartlett, they noted the difficulties in having women come forward and the fears that women had, and the fact that they did believe that there were other women there, but they were reluctant to do so. So I do think that the approach that is undertaken, we do have to, if possible, have the support of Indigenous women's organizations so that they can play an important role in the outreach.
Has your department issued any statements to anybody involved in First Nation Inuit Health Branch, any of the hospitals that are where women are being flown out to receive treatment, to say that forced sterilization is a crime, that it meets the international conventions of torture and genocide? Have you issued any statements warning any of the hospitals where Indigenous women who are under First Nation health services are being treated? Has any warnings been sent out?
We have not issued any specific statement. We have, however, discussed with Indigenous women's organizations providing funding to develop materials for women and for healthcare partners in order to be able to raise awareness about the issue and also provide culturally safe guidelines overall with respect to Indigenous women's reproductive health.
Yeah, I guess I'm concerned because, when the UN Committee Against Torture names Canada and demands immediate action, to me, that's a very shocking thing for our nation. We're not talking about, Good Moms and Healthy Babies programs. We're talking about a crime that fits the Convention of Genocide. So having been made aware of it roughly around the same time that a class action lawsuit was launched against the federal government, I would think that there's going to be some clear steps in place. So what are we going to see from the federal government? We know that the government's rejected the UN call to criminalize this behavior. What concrete steps will you ensure to make sure this doesn't happen again? Because we've seen that it's happened in Manitoba, Saskatchewan, Northern Ontario. If we keep looking, are we going to keep finding this practice? What steps, concrete, to say that this will never happen again?
I think our main role will be to convene federal, provincial, territorial partners, mainstream health organizations, licensing bodies of medical professions, medical associations, in order to be able to collaborate on essentially what will be a series of preventative measures, and also to redress racism and discriminatory practice in the health system where they exist. I think having Indigenous women's organizations play a leadership role in that is extremely important.
Yeah, I guess because last week the First Nation chiefs issued a resolution calling on the federal government to change the criminal code to explicitly outlaw coerced sterilization, because we understand it's happened as late as 2017, maybe later, we don't know. But yet you've issued no statements saying that this is a crime. So would you recommend to the minister that this should be considered a crime at the federal level, that we should have clear laws in place to make sure that this is going to stop and it will be treated with the seriousness that the UN has called for?
I think the Department of Justice has issued a statement on that issue that indicates that they are taking a public health approach. So we would definitely work with the Department of Justice.
The public health approach
is
different than a criminal approach, right? Like, you keep talking about it as a public health issue, and I keep talking about it in the light of the UN and what the chiefs are calling, which is a criminal action. Are we going to see it referred to as a criminal action and not just a public health issue, because forced sterilization meets the international convention rules on torture.
So again, I'm not from the Department of Justice, and I can't speak on behalf of the Department of Justice. The Department of Justice has spoken about the existing criminal acts that exist right now that will prevent forced sterilization and protect women through existing legislation in Canada. However, I really cannot go farther. I'm just not a representative of the Department of Justice.
Excellent. Thank you very much, and thank you, Mr. Angus. We're going to now move on to Mark Ray. You've got the floor for 7 minutes, Mark.
Merci, Madame la Présidente.
Thank you, Madam Chair.
My understanding is, and during question period today, our minister indicated that it is a crime. So is that your understanding, that today, where the laws are, it is a crime for forced sterilization?
That's my understanding from reading the Department of Justice notes, is that existing legislation in Canada does protect women against forced sterilization.
Okay. So, I mean, this is definitely an issue that we have to address. I mean, there's no. We talk about public health. We talk about education. I just want to go back a bit what you said earlier about the la table de groupe de travail.
Oui.
Alors, lorsqu'on va parler avec
The working group, the working table, and what date will they be beginning their work on? Who's participating? And is there a mandate? Is there a type of specific project, or is it just kind of a meeting and then like people leave? Is there something written down that you will be actioning, following up on, and who's participating? At present, our minister, the Minister of Health, are writing to the provincial and ministerial departments at the provincial and territorial level, and then Health Canada will take the lead, or rather will coordinate the working group. Along with the provincial and territorial colleagues, we will be involved, and we will ensure that the national organizations of Indigenous women are well supported to fully participate in the process. So we will be organizing a first meeting and will indeed be working on a mandate for that committee. The idea is to have a committee that's, of course, going to be going beyond a first meeting. We'll be working closely together to address the structural barriers within the health service to ensure that Indigenous women are protected and receive services that are culturally appropriate and safe. Earlier, you mentioned Inspire. I was at the gala, by the way. It's really very good. The prize is given out for participation, and there are as well measures in the 2017-18 budget for midwifery. That too you mentioned. Do you have any statistics or data showing, you mentioned 6 million, by the way, for midwifery, but do you have anything on the outcomes, what's become of that money and what it's helped accomplish? We've just begun that process, and we've been planning it a good deal over the last year to ensure that the demonstration sites will be working well. We don't want simply information and single trials. We want to ensure that these are well planned to be integrated into communities and get real information. Then we'll be able to provide the results of the investment within a few years. We had a recommendation here at the federal level in the committee, given that there are so few statistics. And if I understand correctly, these sorts of things are happening in hospitals. That's a provincial or territorial jurisdiction. Nevertheless, the federal government does need to play a role. If we don't get the statistics, Canada needs to play a role in getting them. So have you gone ahead to see how we could get data from the provinces? There are data on surgical interventions, surgical procedures taking place in Canadian hospitals. And the departments of health across the country do have that data, and we are working with them to see how we could get better information, because they do get data on surgical procedures across the country in the various provinces and territories, of course. Now, it's been brought up here already, the issue of the criminalization of this sort of behavior, but right now we're talking about the health aspect. So there are, of course, the medical teaching faculties, and there's a new one that's been opened. When it comes to information now, and this is not so much a public program, but a Canadian program for healthcare providers. Because, there's a real cultural issue among medical professionals, it seems. We've seen this when we looked at the situation of Indigenous women in the prison system. I mean, it's really a serious issue. So should we consider how to better educate medical professionals, health providers, and if the provinces don't approve, what the hell, we'll do it anyway from Canada. The Royal College of Physicians is able to ensure that cultural education be mandatory in medical training. And this is a big step forward that they took in 2017. The National Association of Indigenous Doctors is also developing a series of cultural skills that would help fill out the requirements and provide for real curriculum. They're also trying to ensure that people better understand trauma to be able to provide trauma-informed care. So it's more than cultural sensitivity. It's also an ability to understand the specific history and issues faced by Indigenous peoples given intergenerational impact of trauma due to colonization, residential schools, and other effects on them as well, even within the Canada healthcare system. Are there any programs we've funded in the last few years that might focus better on Indigenous women to give them the tools to raise awareness themselves, to go to the universities, the colleges, or even to the provinces or organizations to teach other people about these issues? Could we fund them to do that? Could we allow Indigenous women's organizations to spread the message? I think that's an excellent idea. Very good idea. The National Association of Indigenous Women here in Canada does have a training program on cultural competency, but it's of a general nature, not specifically focused on healthcare providers and medical professionals, but I'm sure they could adapt it to that audience, so we'll surely suggest that idea within the committee.
Okay, we're now going to move on to our second round. Those are all 5 minutes, and we'll start off with Kathy Wagenthal. Kathy, you have the floor.
Thank you, Chair. I have a question in regards to the Indigenous issues around sterilization globally. UNDRIP talks specifically about their rights to freedoms, not forcibly removing children, all of these things. Have you worked with Global Affairs in the Department of Justice in looking at Canada in relation to other countries in the world, such as Africa, where there's a real movement internationally with the Mary Stopes Foundation and others, our government putting funding towards basically controlling populations through sterilization and removal of the fetus?
So I have not specifically. We've certainly worked with them in terms of preparing materials for the studies that the UN had conducted and the committee presentations and for responses to specific questions that they've had. But we've not had a discussion with them, unless, Catherine, I'm missing something, okay, making sure. We've not had a specific discussion with them to actually put that into that global context. I think it's an excellent suggestion, and we definitely should do that.
I would really encourage that, because it seems like we are doing one thing here and another over here.
Yeah, no, absolutely.
Also, you were talking about health services barriers to our First Nations communities. And the goal I'm hearing is to give them freedom and autonomy in taking care of their own community's healthcare delivery. That is the goal?
Absolutely.
Okay, and with that autonomy then, they have the opportunity to determine what that should look like? Okay.
Absolutely.
I actually have a community, First Nations community, that has met with me and with the community that they live beside that has a hospital they were building and adding on. They wanted to contribute to that facility because they use it extensively. And they weren't allowed to because the funding that they receive has to stay within certain pillars, and basically their health dollars have to stay on their First Nations community reserve. Does that make sense to you?
It is actually part of the conditions of our health infrastructure program, is that we fund health infrastructure on reserve. But I do think that we're looking at different options with respect to innovation, and by enabling communities, for instance, to have access to grants or to have access to more flexible agreements, which this government is very, very committed to under the new fiscal relationships, communities will have more flexibility in terms of how they can access.
So that flexibility is there as long as they do it only on their own land? Like
The terms and conditions of our program are that we fund health facilities, but in a First Nation
So
community
even if
on
that
reserve.
First Nations community says that this is what we want to do, and I can't think of a better way to build reconciliation than to be working and living together, if they find that that is the best way that they want to have those services provided, that wouldn't be an option for them as far as determining self-determination of how those funds would be
It would be an
spent.
option for them if they had other sources of revenue, but if I would need to know a little bit more about the specifics of the situation that you're referencing. But in terms of if they had received health infrastructure funding from our department, it is to build facilities on reserve specifically.
Okay. One other question, you mentioned about the opportunity to have an escort come with them.
Yes.
When they deliver, which I think is wonderful. Would there be a priority, first of all, for the father to be that escort in light of trying to encourage family cohesion? There's nothing quite like a dad watching a birth to build that sense of responsibility. So would that be something you would build in there, that first and foremost that individual would have the opportunity to be that escort?
We don't place restrictions on the escort in the sense that it's a woman's choice, but we definitely we do have a responsibility to ensure that the escort is able to support the women throughout labor. And of course, we would sort of say a family member, a close family member, is obviously best placed in most circumstances to be able to do that.
Okay. 1 minute. Okay. Let's see. The maternal child health program that you're speaking of is specifically an Indigenous First Nations program?
We also fund territorial governments also to provide some support in Inuit communities.
Okay.
So it's First Nations and Inuit program.
Okay. Can you give me a little bit more detail on what the priorities of that program are?
So it's an ability for communities to have support services for women prior to birth and after birth, and also to support those early years
So
with
right
respect
in their
to families.
communities?
In their communities, in their home. So there will be home visitors that will go, and similar to some of what provinces have also, well, you'll have a home assessment, and a nurse or a family visitor will come, and they'll speak with you about how you're doing and your baby and everything else. They'll follow up on immunizations. They, of course, are a great support role for breastfeeding. And some communities have chosen to hire doulas or to support doulas in the community to also exercise that role, or in some cases, even midwives will exercise that role.
Excellent. Oh, sorry. Excellent. We're now going to move on to our final line with Eva Nessev. Eva, you have 5 minutes.
Merci, Madame la Présidente.
Thank you, Madam Chair. And thank you very much, Ms. Judy. And I have a question for you. Here in the class action, we see that in October 2017, it was understood that finally that these practices had been underway for a good 10 years or over. And so why did it take so long to figure that out for you within the department to figure out that this was happening? It's pretty late in the day. Our department does not directly manage surgical procedures or services in that area. We do have 2 hospitals that we are funding and operating, but these are small hospitals. They do not carry out surgical procedures. Within the department, then, what we do is offer primary services or nursing services in some isolated communities. Across Canada, the provincial healthcare system or territorial healthcare system has jurisdiction over surgical procedures, and they govern medical services within their areas of jurisdiction on their territories. We offer complementary funding for communities, but not for specific reproductive health procedures. Yet I still haven't understood why it's taken from 10 to 15 years for this to surface, for it to become public, these crimes, these forced contraception, these tubal ligations without consent of these Indigenous people. Why has it taken so long? Well, it hasn't necessarily been for 10 or 15 years that I or we have been, well, here, October 2017, this class action suit is filed, and there it's recognized that this has been underway for 10 or 15 years now. In Saskatoon, of course. I'm speaking of Saskatoon. Yes, I understood that, but we're not directly involved with or linked to the health agency of the Saskatoon region. So we don't manage health services in that region. We do fund Indigenous health in that area, but we offer community services and not special surgical procedures of this nature. Had there been any complaints, we wouldn't have had access to that information within our department. So the lack of information, the information block that was in the territories, well, it's a provincial system or territorial system, would have a closer link to the regional health authorities, the patients, communities, and women who access those services. This isn't a matter that was brought up to us by First Nation leaders or Inuit leaders participating in our processes and activities. That doesn't mean nothing was going on. It just means that it wasn't one of the issues that we were working on with Indigenous and Inuit leaders. There are a number of other issues we work on with them, such as cultural competency in healthcare services, responses to discrimination. These are the issues that are brought up with our partners, regional and national leaders, but this issue wasn't brought up per se, at least certainly not brought up to me since I have been with the department. Still speaking then of Saskatoon, during their study, Senator Boyer and Dr. Bartlett said that it wasn't only a matter of these practices, these tubal ligations without consent. They also said it was a matter of there not being other types of contraception available. So why are you funding these organizations and these interactions without giving people other options? Well, there are many contraception programs and options offered via our non-insured health program for First Nations and Inuit persons. We offer coverage for a number of contraception processes and medications, all available to these people. And this will be an important point to point out in the documents that we will be drawing up with them to improve communication and improve the availability of information to the women directly where it's needed. So there were other contraception approaches available? Yes. I know, of course, this is a provincial matter, provincial jurisdiction, not federal, yes. That said, we could work on it, I understand, under the general topic of consent. Yes, and there is a joint program that we are working on and have been working on since 2014 with Indigenous organizations, and we are still working there to ensure that people have better access to information so they know what medication is covered and what we are able to offer to them.
Committee, I'd really like to thank Catherine Cole and Valerie Gideon for coming forward and bringing forward this information for our brief. Just a reminder to the committee, we will be meeting our next time on Tuesday, January the 29th, to continue our consideration of the draft report on study of barriers facing women in politics. And there will also be a first draft that will be coming out to everybody by January the 25th regarding our shelter and transition houses study. So to everybody, have a wonderful holiday, Merry Christmas and Happy New Year. See ya in 2019. I got everything done you want me to do?